Hi, my name's Kelly. I'm a CBT therapist and forensic psychologist, and today I wanted to give a little bit of the insight into some of the risk assessments that are used within forensic psychology. So you have three main types of risk assessments. You have actuarial risk assessments, you have structured clinical judgment, and you have unstructured clinical judgment assessments. So I wanted to talk through all three of them to give you an insight into how they're used within forensic psychology. So actuarial risk assessments are ones that relatively you don't really need much training because they are standardized assessments that are often maybe based in questionnaires, or they can be any sort of question-based assessments that when an individual answers, it's assessed against predefined criteria that have been tested and retested. So it can be done quite quickly, and it can be very reliable because it's got a lot of evidence base behind it. So it is often used because it is quick and it is reliable, but there's not much of interpretation from a professional within it. So you'll get maybe a number that this number says X, but then you want really a professional to be able to give some sort of information behind that. But then you have the complete opposite, so unstructured clinical judgment. So this could be when a professional is relied upon to use their own ability to assess a situation, but it's not structured, it's not set around anything. So there isn't any sort of evidence base that is informing the answers. It's not against a predefined criteria, although the expert of course will have these things that are going around in their head. It's not just kind of ticking or answering certain questions. There is more areas that maybe be discussed, and it's more open to interpretation of the expert. And then you have structured clinical judgment, which arguably is a merge between the two. So you still have a predefined set of criteria that an individual, the clinician or the expert, will ask questions around, but then the clinician or the expert will then assess and use their own expertise and their knowledge to be able to come up with answers. So for example, it may be the HCR20 is a really common one that is used and classed as structured clinical judgment. So there are a variety of topics that are discussed, and there are a number of factors that are discussed, and the criteria is kind of reviewed against it. And there is a scoring system. So similar to actuarial, we have the scoring system. You also have scoring in the structured clinical judgment, and the clinician can still impress and express their own opinion, knowledge and expertise. So it has the structure of the actuarial. It's less open as the unstructured clinical judgment, and it can still provide the individual with a range of knowledge and level of understanding that you may not get from some of the other areas. So they're the three main ways that risk is assessed within forensic psychology, and I hope you found that helpful, just to give a bit of an insight into the risk assessments that are used on a regular basis. Please check out my other videos, like and subscribe, and thank you for watching.